In the name of God, most merciful, most compassionate, to start with, I would like to welcome you again at this press conference that has been interrupted for more than 2 months now because of COVID-19 pandemic, and of course the measures that followed to that, preventive measures including lockdown and social distancing, the thing that made us suffice with the daily updates and briefings. However, now that we have taken a set of decisions to organize the reopening of public departments, we started to convene these press conferences. As you can see, there is sufficient physical distancing between the participants here, and we are complying with the preventive and precautionary measures. And as His Majesty says, the citizens' health is a priority, and therefore the government shall take all measures and actions needed to safeguard the health of citizens and their safety. To that end, the government and since January the 24th of this year, the government has taken 400 decisions in relation to dealing with the COVID-19 crisis. As you know, yes, there have not been press conferences before, but we had daily communication and contact with the media, whether through the Minister of Media or through the other ministers. We conducted hundreds of interviews, media interviews, TV, and press interviews in order to update you about the developments related to this pandemic. Now, as for the press conferences, as you can see, as you know, this is the first press conference, and we shall convene it every week and as per the need. And in all cases, we will be in touch with you, and we will be updating you through the different briefings and through media interviews, be it with TVs, radio stations, and different media outlets, including newspapers and online newspapers. Today we have 14 colleagues, 14 journalists representing different media outlets. And this is not the only group who's going to ask questions. We have the other colleagues, other journalists who can raise their questions through the website of the Prime Ministry, through the window of Ask the Government in the platform of بخدمتكم. Now we're going to evaluate and assess this experience. We hope it's going to be a successful one, and we hope that it will answer the questions and the queries of our colleagues, and we hope that it will be delivering timely information. Now we have with us the Minister of Health, Dr. Saad Jaber, and the head of the crisis cell, Brigadier Mazen Al-Farraya. Would like to welcome them both. And after his excellency delivers his updates, and Brigadier Mazen also delivers his brief, we're going to open the floor for questions. In the name of God, most merciful, most compassionate, good afternoon. Today we had 20 people who tested positive, COVID-19 positive, to make the total number 649 cases since the beginning of the pandemic. The cases are distributed as follows. 3 are for lorry drivers from Al-Amiri border post. 1 is Jordanian and 2 are of other nationalities. And 1 case is of a nurse at the medical center at Al-Amiri border post. He was transferred to the hospital. The medical center has been suspended for 3 days, and it's being disinfected. And there are 2 Jordanians who are in quarantine now. They had come from the UAE, and a while ago I was informed about 14 cases from Al-Zarqa. They are contacts of the Al-Khanasri case, the lorry driver, noting that the area from which these 14 persons come is under isolation since last Thursday because one of the contacts was discovered, and we identified him as that in that location, and the whole neighborhood is going to be retested next Thursday and Friday as well, God willing. Also, there have been 4 recoveries at Prince Hamza Hospital, the thing that makes the total number of patients under treatment 142, and thank God there have not been any deaths. Today, we conducted 4,126 tests to make the total tests since the onset of the pandemic 148,482 tests. We're waiting over the few coming days. We're going to operate a new device which will raise our testing capacity by 4,000. Thank you. Good afternoon. As you know, the crisis cell, in coordination with all ministries and departments, has started the implementation of the repatriation plan. On May the 5th, the first stage was finalized, and the number of repatriates were 2,917 persons. The second is at its final stages. We received 3,572 repatriates there at the hotels of Amman. We're going to have a flight to Doha on Saturday, and we're considering yet another flight there because they're to Doha because there are so many Jordanians there. The total number of persons who were repatriated is 6,855 persons. All are under quarantine in Amman and in the Dead Sea, and very few in Al-Aqaba. The countries from which we repatriated were mainly Egypt, Turkey, KSA, UAE, and USA. Of course, we also have coordination with the airlines, foreign airlines, who would be repatriating their own nationals from Jordan. And we always receive questions about the platforms through which people can register. It's going to be reactivated in the coming 2 days. So those who could not register earlier would register now. The third stage of the repatriation of students and the Jordanians stranded abroad is going to start on the 28th of this month. There will be flights from several countries like UAE and KSA. There will be flights from countries we repatriated from earlier, and there will be flights from countries from which we have not repatriated from earlier, like Sudan, Algeria, and Hungary. So this is about the repatriation plan till the date. Thank you very much, Your Excellency. Okay, now before we open the floor for the colleagues, I have received 2 questions through the website. One is by Majd Al-Batiyah from Al-Wakil News about the odd even scheme, whether it's going to be implemented after Eid holiday. The answer is, when it comes to the operation of the odd even scheme, it's going to continue until a further notice. And as you know, these things and these matters are evaluated on daily basis during the meetings. And I know that some people are not happy at it, some are happy, but this is an unprecedented crisis in the whole world. And of course, this is not an ideal time. And of course, we don't claim that our decisions are ideal as well. And therefore, if we take any decision and then we reverse it, we reevaluate it later, this is in the interest of citizens. And all of these decisions we're taking is in order to protect the health of citizens. Another journalist is asking about the Eid holiday. The Eid holiday, as we announced, starts on Saturday morning, May the 23rd, until Monday the 25th. Whether the first day of Eid is Saturday or Sunday, it's going to be a comprehensive lockdown on vehicles. Yet citizens are allowed to go out of their houses on foot between 8 to 6 p.m. This has not changed till the date. However, everything is subjected to evaluation on daily basis. People are not allowed to use the vehicles on the first day of Eid, except for the medical staff in the private and public sectors, the epidemiological tracing teams, in addition to a very few number of officials and officers in essential agencies. We received the feedback from our colleagues, the journalists, welcomed feedback that they asked that they should be allowed to go out on this day. We're considering this, in fact, and we will announce a decision as to allowing a minimum number of journalists to go out on the first day of Eid and on the comprehensive lockdown day being Friday. As for the rest of the days, of course, we're going to resume the methodology of and the odd-even scheme in Zarqa, Balqa, and Amman, and as per the days of odd and even is going to be decided by PSD. If the third day of Eid is on the 27th of May, yes, it's going to be the first day of business. So Tuesday is the first day of business, and even if it was the third day of Eid. And like I said, Friday is a comprehensive lockdown day. And like I said, these decisions are subjected to daily evaluation. The second question is from Haya Arafat. It's about the news being deliberated about the agreement between the Parliamentary Tourism Committee and the government to open Queen Alia Airport and to open King Hussein Bridge. So they test comers. If they are Jordanians and if they test positive, they will be referred to Prince Hamza Hospital. If they are non-Jordanians, they will be deported. Well, according to the information that I have and that of the crisis cell, no, this is not accurate. As for the reopening of air travel and travel in general, this is subjected to the developments of the epidemiological situation. There are so many things that we need to take into consideration before we reopen airports and borders and before we resume the action of travel and tourism. Misto is the head of the Civil Aviation Regulatory. They are considering, and they consider all of these scenarios and the technical requirements in preparation for the stage where we actually reoperate airports and border posts. Till the date, there are no indicators that borders and airports are going to be open soon, on the short term at least. May I ask everybody to mention their names and the media outlet they represent. Good afternoon, Muhammad Al-Fayez from Al-Mamlaka. My question is to the Minister of Health. I'm asking about the area from which COVID-19 cases appeared. The area is wider. Is that an indicator, a risky indicator? Yes, in fact, the geographic spread of from which we register cases is widening. However, the good news is that there is no anonymous hotspots. هو لازم يكون Muhammad Al Fayez from Al Mamlaka channel. My question is addressed to the Health Minister of Health. We're talking about a wider geographic area from which we are registering COVID-19 positive cases. Is this a risky indicator when we compare it before, and how we're going to address it? Indeed, the geographic area from which we're registering cases is wider now, but there are risky indicators which we have not had now. Number one, when we have 3 successive days when the cases are multiplying. And the second is that when there are unknown hotspots, 3 unknown hotspots. Now, all the positive cases have been infected from known sources, and we have traced them. There are no unknown hotspots. The 14 cases I learned about today were a shock for me. However, they come from a well-known hotspot for us. We know where the infection came from. We said that before. The more open we get, the more cases we'll see. Of course, we worked with the Ministry of Industry and Trade and with the Prime Ministry. We set the conditions where we're going to raise the lockdown or to ease it. We're at a situation that is called yellow. Like most of the industries are open. Lockdown is at the evening. There is a comprehensive weekly lockdown, which is about breaking the infection cycle. I think till now, the situation is good, and we hope that it's going to continue to be so. And we hope that our teams will be able to clean these hotspots, isolate the positive cases, and make sure that they don't have contacts. Abdullah Musmar from Amoon News Agency. In fact, many countries in the world have suffered from COVID-19 a lot, but they started to ease lockdown, they started reopening. Now that we can see the reopening in the world, why are we not doing so while we have succeeded in this experience? I don't know how many questions I'm allowed. Number 2, to what extent do you think the government has succeeded in implementing the defense orders after 2 months since the issuance of the defense order? The last question is about our relation with Israel. You know that Jordan has threatened to freeze some parts of some provisions of the peace treaties. What do you respond? Okay. You see, the economic medical plan strategy in dealing with this virus is different from one country to the other. Some countries kept their scope open, and they had deep medical and health and economic shocks. However, some countries managed to control the number of cases because of a strict lockdown. Jordan is one of these countries. Now there is gradual reopening in all countries of the world, including the ones where there is prevalence. The strategy differs from one place to the other. You see, the world is no longer the same. Since 3 months ago, we did not know how to deal with it. Now that we have seen the economic shock in so many countries, countries started to reopen gradually. People got used to following the preventive measures and to take care of themselves. Our preliminary control over the virus was not only in order to control the virus, it is to give us a chance to build our capacities. We have the capacity, we produce what we need. Before that, we didn't even have the masks. Only 1.5 million masks were there. But today, I just procured 4 million masks made in Jordan. We are producing suits, and these things can be exported. In the past, we had only 2,200 tests. Now we can, we have this many. And now we have so many tracing, epidemiological tracing teams. Our capacities have been built. And therefore, we have started this gradual reopening. And this is a good thing, in fact. We are much faster than others. We can control now. We hope there won't be more prevalence. I think that will make us strict the lockdowns. Now we have a threshold. If it arrives at this level, we will close down some sectors, and we decide which of them we have defined which of them will be open. And of course, no country can close everything and keep people at homes for 3 months. For 3 weeks, you know, it's more than enough for 2 weeks for some people. So we hope that the reopening will not lead to too many with too much increase in the cases, but we'll see. Now, as for compliance with the defense orders, indeed, the success Jordan made, if we can say that we have succeeded in dealing with this pandemic, it was thanks to the compliance of citizens. The defense orders were a tool that we used in order to deal with the situation. Of course, there was compliance, and there were violations, and anybody who violated the orders were penalized. They were made to pay fines, and their cars were seized for months, and indeed thousands of cars were impounded. But I must say that in comprehensive lockdown, compliance was at 99%. In partial lockdowns, there will be violations, and we deal with them. We penalize these who violate the defense orders, and that applies to all defense orders. Some enterprises have violated, and they were locked down. The enterprises who did not make their staff members or their customers put on masks or to follow the preventive measures, some were penalized, some were made to pay fines, and some were locked down. This is how we dealt with this situation. As for your last questions, indeed, His Majesty the King was explicit. He said, if there are any unilateral decisions taken by Israel, there will be measures taken by Jordan, and the relation might mount up to conflict. Jordan will not accept unilateral decisions. Jordan, and of course, this is supported by the different countries in the world, the EU and the different countries in the world, support the legitimacy decisions, international legitimacy decisions, and Israel has to comply with them. Thank you. Good afternoon. Abdul Hakim Al-Garale from Al-Ra'i newspaper. I'm asking about the quarantine sites. May I ask you please to have one question only to keep track of time? We only have 40 minutes and we want everybody to get to ask their questions. I'm asking about the quarantine sites that you're going to build in governorates. Have you started building them? Do you have any information about their capacity and so on? And the other question is about the reopening of different industries after Eid. I'm talking about universities. Are we going to continue the remote learning, or will students go to study on campus? Okay, as for quarantine sites, quarantine is now in the Dead Sea, in hotels or in the caravans. And we have 1,000 caravans, and another 1,000 were established. So in the next stage, we have 2,000 caravans to accommodate the repatriates in addition to the hotels. Now, as for the sites of quarantines in the governorates, we have not yet decided what they are. The main considerations are going to be the number of people coming, where they're coming from, what they can afford. Some cannot afford paying hotels, and therefore, according to these variables, we're going to decide when and where these sites are going to be built. And this is a matter that is taken very seriously and thoroughly considered. As for the As for resuming normal life, this is dependent on the epidemiological situation. That includes universities. Summer course, will it be on campus or not? This is to be decided after Eid as per the epidemiological situation. Ismail Salawi, Ru'ya Channel. My question is to the Minister of Health. I'm seeking a clarification about the repeal of the bonus of workers in the medical sector, and which has been referred to as incentives. What is the difference between them? May you clarify that, please? The second question, a very short question. The Jordanians stranded in Palestine, are they going to be allowed to come to Jordan after you open the bridge? Will you open the bridge? Now, as for the incentives and the remunerations for the medical staff, they were not compromised. You see, remuneration is one thing that is different from the salary and the bonus. Remunerations and incentives were not compromised. They were distributed fully. As for the bonuses, which were referred to, the bonuses which were cut, these bonuses were cut upon the decision of the Prime Minister and included all civil servants, No, I didn't say it's exclusive to the medical sector. It was for all it's for all civil servants. There had been a decision upon the recommendation of the Ministry of Health. It was on January the 26th. We mentioned there will be a pandemic. That was even before the pandemic spread from China. We said there will be a pandemic. We will be in a bad situation, and for that time, we would need incentives or remunerations for the medical staff. And on February the 2nd, the Ministers' Council approved. It was even before the pandemic gets to any country in Asia. So that incentive is in order to compensate the loss for the medical staff, the loss they incurred because of the cutting of bonuses. May I respond to your question? A very quick answer. Yes, we're going to allow Jordanians stranded in Palestine to come through the bridge. Some people are there for treatment, and therefore the repatriation needs some preparation in order to receive them and then transport them to the hospital. God bless. We must say that we appreciate your efforts because the government has done a great job, and also the public media has done a great job during this pandemic. And my question is about the quarantine of students, the quarantine of the first batch of repatriates. It's about to finish. What measures are you going to take in that regard? Their quarantine will end when the Eid starts. How are you going to control that? So, and my other question is about the first business day after Eid. So what would happen? We just go to work, all civil servants go to work on Tuesday, the 26th? Or will there be a gradual steps until everybody joins their workplace? As for the first group of repatriates, they arrived on May the 5th. They're going to leave the hotels on 23rd, 24th of May, and they're going to, they will leave to their houses on vehicles. And yes, I think that this is a moral obligation of citizens, the repatriates. Yes, it's a good chance to be for them to be among their family in Eid. There shouldn't be visits or gatherings and intermingling during this period, post-quarantine. After Eid, yes, the public sector is going to resume business after Eid. However, it's up to every minister and every department director to decide the number of staff members they're going to have in the workplace. And also, we have flexibility. For example, persons who have medical history, they shouldn't go to the workplace. Pregnant women, nursing women, and also it's up to the discretion of the minister, of the official, as to how many staff members will be there. Everybody should be working, but there can be exceptions taken by the direct manager as to who's not going to be present in the workplace. Muhammad Kayali from Red newspaper. I have two questions. Now, we do not have a vaccine. The WHO says that it's going to take a while until a vaccine is found. Economies have started to fall, in fact. We're going to resume business after Eid. Will that eventually take us to a level of herd immunity? This seems to be something rejected several times. Kit. I'm asking about the test kit. Does the sample, does the test give an accurate result? Thank you. Now, as for the lack of vaccine or treatment, hundreds of centers in the world are working on this. Many treatments are being experimented in the world, some in Jordan, in fact. We're parties to some international studies in regards to some treatments. Tomorrow, we're going to join a Japanese study with some, and also we're going to join some specialized centers in the world to test treatments against viruses, antiviral treatments. Some expect that the vaccine will appear in August, maybe in the fall. We shall wait and see. Now, the philosophy seems to be a big word, but you need to have a philosophy and a strategy upon dealing with this. When we get to a point of suppression and we had 0 cases, some said, what you're doing is wrong, because it can't be seen that people do not have immunity, and then people have no immunity, then you will suddenly open the industries, and then you will have 500 cases a day, and then you'll have to close down again, and that will be another shock for your economy. According to experts, it's good to have a few cases, gradual few cases, the thing which will allow the immunity to build, yet the number of cases does not exhaust the medical sector. The policy that we followed was to crush the numbers. But some say this cannot continue forever unless you follow very painful lockdowns. But some say you can have medical audit care and follow-up and epidemiological tracing, and penalize those who violate these measures. So we develop a kind of culture that allows us to deal with the situation. Put on your mask, put on your gloves, wash your hands every now and then, keep the physical distances. Look at us here. We are maintaining physical distances and things are going well. We don't have to do it the way we did it before. And some say the immunity of herd. I don't like the word herd because we're not herds, but it's okay, it's been used. But what I say, is that as long as our numbers are not scary, this means that we are on the right course. Our economy is operating. If people are going to go to business and to make their livelihood, we can support them just by being compliant. If you comply when you're in Aqaba, you will be helping a person in Mafraq and a person in Amman to put food on their table. You see, we are just like one body, and we're organs in just one body. This is the idea that we should, this is the conviction that we need to have. It's about a social responsibility, our responsibility before God, before this society. This is my answer. What's the other question? I forgot it. It's about the test kit. Internationally, the accuracy is 80%. I would say it's between 80 to 90%. It's a high rate. Some tests, we received some tests, they said, some kits, they said the accuracy is 98%. However, it's all up to the way the test is taken and the sample is taken. And this accuracy is very well taken in, it's very well taken and it's considered acceptable. From Al-Haqiqa Al-Dawliya, when you announce cases whose sources are not known, how concerning is that? And do we have such cases? Also, as to the inaccuracy of PCR tests, to what extent did this allow the infection to spread to people who did not have the disease before? And when we resume, the other question is about reopening the public sector. Some civil servants are in different governorates. How are they going to go back to their work if they do not have their private vehicle? I take the second question, you take the first. Okay, in epidemiology, if there is a case whose source of infection is not known, this is concerning because we're afraid that they have contacted it to dozens of people, and we call it in-country prevalence, and that is concerning. Now we do not have any unidentified source. When we have any case, we work all departments, security departments, there's administrative governor, we talk to the community, to their neighbors, we have their contact information. This has become a science. In fact, I did not expect that it will come to a point where this is a science and a scientific methodology. Now we know all of the cases, sources of all cases. Are you asking us for the accuracy? You're asking why somebody would be negative now and test negative and then be positive in a week? This is not related to the accuracy. Well, you might test me now and I would test negative. You see, the virus will reproduce in my body and attack me, whether I will feel it or not. That is the incubation period for 5 to 14 days. In 85% of the cases, the onset is after 8 days. Before that, you might test somebody and they would test negative. Maybe the same person would be tested in 6 days and they will test positive. This is not related to the accuracy of the test kits. It's because of the nature of this virus. As for your second question, we've been considering opening provinces. We know that Amman, Zarqa, and Salt, and Madaba, people who work in Amman or Zarqa, they're from the same government. They work in, people would be working in Amman while they are living in Zarqa and so on. We're considering this and we'll take a decision by the end of the, after Eid, upon the recommendations of the epidemiological committee. However, if the person does not have a private vehicle and there is no public transportation that will allow them to go to their workplace, their superiors and the directors should be flexible. As for opening travel between governorates, this is going to be well studied. Maybe Mazen Bek has more information about this. There has been a consideration in this regard, but the decision will be taken soon in that regard. Indeed, opening governorates, travel between governorates is purely health issues. The more closed, the more areas are closed, the easier for you to control the prevalence is. Now, as for the sectors, they are reopening gradually. Some, you see, governorates and isolated, and people are rejoining their workplace. The directors and superiors in the workplace need to be flexible, and sometimes they need to make some sacrifices. Muhammad Tarawni from Khabbirni. My first question is to Brigadier Mazen. Is there a time period during which the Jordanians will be allowed to be repatriated without quarantine? Engineers, doctors, and so on, they have vacations, holidays, summer holidays. We're talking about a 1 month holiday. Are they going to be allowed not to have quarantine? And also there seems to be disagreements in relation in the epidemiological team committee. One doctor has resigned, Wa'il Hayajne and Dr. Mahabda are not allowed to speak to the public and speak to the media. How do you comment? Well, as for the crisis cell, we are closely considering the applications of Jordanians wishing to be repatriated. The priority was given to Jordanians and those who were stranded abroad. And the advice was always like this: if you're safe in your place, be there, stay there. We cannot, our first advice is that as long as you're safe in the place you are in, you don't have to come, don't have to come. Please don't come. Is there a clear time frame? Well, this is to be decided by the epidemiological tracing teams and the epidemiology committee. Now, when are we going to resume business as usual? Now we are not going to resume business as usual, but now we only repatriate those who have to come. I would like to start with thanking the epidemiology committee. We've been working as one team since day one. The epidemiology team committee is formed by the Minister of Health. It had been formed before I become a minister, and it includes representatives of all sectors, the private sector, Dr. Hammouri, and some physicians, and from the Professional Association of Physicians, the Royal Medical Services, universities, the Minister of Health, and some other experts. And all of them are experts. Epidemiology is a very sophisticated science. It depends on the nature of the disease, the virus, methods of prevalence, and so on. And there are always different opinions within the committee. Some are very strict, like Dr. Hayajne. He doesn't want anyone to leave their houses, and Dr. Azmi says, open everything and let people go out. This is about different opinions. We're 24 people and we take our decisions collectively, unanimously, which can be different from the opinion of X or Y. And the committee take decisions in writing. And everybody signs, even if they disagree. However, they can consent and they can write their reservation. And these are not decisions, they are recommendations. I receive and then I pass to the crisis cell, and they say these are the recommendations of the epidemiology committee. And at the end of the day, it's them who decide or not. Now, the process of announcing and sharing information and sharing information about frustration at some decisions, this has caused some confusion, especially when cases are reported, or when somebody says, I'm not happy at this measure, somebody else would say we should strengthen the lockdown. Some would say we should not. We said, well, there should be one spokesperson, Dr. Nadir Amita. He speaks on behalf of the committee. If you don't accept it, you can just resign. Dr. Nadir, a very well-spoken person, and I don't think that he has hidden any information. He presents things in a very nice way. All of them are nice, and they're my colleagues. But what I'm saying is that what he speaks of is the opinion of the collective opinion of the committee, while others are saying their own individual personal opinions. We don't want to give a wrong impression that there is a disagreement or there is a conflict. And I asked everybody, not to share their opinion, making it look like it's the opinion of the epidemiology. Everybody, when they share their opinion, they should say that this is my personal opinion rather than that of the committee. And by the way, I'd like to know that we're all friends. There aren't any conflicts whatsoever between us. Let me take the last question, please. Good afternoon. I would like to ask the Minister of Health, after the case of the nurse in Al-Amiri border post, are there going to be measures after that? After discovering this case, in fact, every 10 days we test all the workers at the border post. 6 days ago, last Saturday, I was with the ministerial committee over there, and then on that day there was a test for all workers, and in fact these tests are conducted every week. And we detected this case, and you see there is a protocol. We immediately closed down the center. The contacts of the case were told, the nurses and the doctors, some of them are at quarantine, some are at home quarantine. We've taken samples. We are disinfecting the medical center. After the disinfection, new people are going to come to the workplace, and the workers at the border posts are going to be tested. And then after a week or 8 days, we will redo the test. There is a protocol for everything. Of course, it's daunting, but we need to understand, yes, so we're going to open our border posts. There will definitely be cases. Sure. They were tested, they had been tested 5 days earlier, and all the results come together. So before we conclude, I just want to remind that next Monday is the 74th, marks the 74th anniversary of the independence of Jordan. And on that precious occasion, we're going to express and we're going to celebrate by way of raising flags on houses, and the Air Force is going to conduct shows, air shows throughout the kingdom, and there will be performances by there will be celebrations by the armed forces, and we thank the Jordanians and the citizens for their enthusiasm, who are going to raise flags on their houses and on buildings, expressing their pride in their country. The country, the homeland that proved its resilience and its ability to make it through the worst of conditions. Thank you very much. I'd like to thank the Minister of Health.